All right, guys, let's talk about sleep regressions, a super important topic. Hi there, my name's Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom. If you're just joining me now to learn more about sleep regressions, welcome. If you haven't already, please feel free to hit the subscribe button below. We talk not only about sleep advice for newborns, but pediatric topics, parenting topics, and breastfeeding as well. All right, so let's get started. Let's first talk about regressions and get this out there. That regressions can be a very scary word for some parents, but regressions exist. They can happen when your child's teething, they can happen when your child's ill, with vacations, with trips. Think about it yourself. When you get back from a trip, let's say, or maybe let's say you're traveling and you go to a hotel room and you have some icky sleep that first night. When you get back, it takes a few days to get into your routine. You could call that your own regression. This happens really commonly with children. We just fixate on it because I think as a society we put a pretty big emphasis on sleep, which isn't a bad thing. It's okay to be educated, but it's important to know that regressions are totally normal and they happen. So what is the dreaded 4-month sleep regression? Well, around 3 to 4 months of age, your little one begins hitting some developmental milestones, and rather than really continuing that newborn pattern of sleep, they actually begin to have more cycles of light and deep sleep. So what kind of developmental changes? Well, first of all, it's important to know that before this, newborn sleep does vary quite a bit from adult sleep. Newborn sleep has more active REM, so now at 3 to 4 months of age, sleep is starting to become more similar to adult sleep. So they begin to go through more cycles of sleep. Essentially, their sleep is beginning to mature. On the second part, which is great news, is they actually begin to secrete more melatonin, which helps set their circadian rhythms. If you're breastfeeding, interestingly enough, mother's milk does have small amounts of melatonin, so if you're nursing your baby at night, super cool. If it doesn't work for you, which sometimes I used to be like, where is that melatonin in my baby's breast milk? It's totally okay. Just a fun factoid. So what happens as they add in more of those sleep cycles, they may have brief periods of awakening. So this is called the dreaded 4-month sleep regression. There is a little bit of a hump to get through, but just know that these sleep regressions do resolve. If you were to do absolutely nothing, you will get through this 1 to 3 week period just fine. But I think, again, it's really helpful to educate parents out there, so we can talk more about it now. So as they begin to wake a little bit more fully during these sleep cycles, it can disrupt their sleep pattern, especially on the outside as parents looking in. We say, hey, they're waking up more frequently, it's taking longer for them to go to sleep. It is a temporary state. This isn't something that's going to last forever, but obviously when they're fully awake, they may need a little bit more help from you to get back to sleep. So for my oldest daughter, I'll tell you what her sleep regression looked like. She was pretty much waking up every hour, and she wouldn't necessarily get into a full-blown cry because my mistake was I never really let her work it out around this age. I would jump up and I would immediately plug her mouth with a pacifier. She was already kind of sleeping through the night and not taking night feeds, so this was, again, a regression from where we were sleeping through the night to waking up every hour. I didn't want to backtrack and begin feeds because weight was going so well already, but I was essentially not getting sleep either because every hour, sometimes multiple times in an hour, I was up trying to place the passy. I called it passy pong. It was terrible. I found it difficult, but again, that's kind of how we limped through it for about 2 weeks. Maybe 2.5. And typically sleep regressions do last about 2 to 6 weeks. Improving sleep after the 4-month sleep regression is really in yours and the baby's hands. So if you choose to essentially maybe begin adding in some good bedtime routines, sleep hygiene habits, which I've hit on in past videos, then you can absolutely get on the right track after the 4-month sleep regression. So the 4-month sleep regression, just because it's called a 4-month sleep regression, doesn't necessarily have to begin when your baby's 4 months. It might actually begin before your baby is 4 months old. And that's what happened with us, actually. I think it began when my oldest daughter was about 3.5 months old. My second daughter hasn't yet reached her 4-month sleep regression, so we will see when we cross that bridge what happens. But I want parents to know that there is a wide range. The best way to explain what's going on in baby's mind and their brain and their body and their environment is to imagine that you went to sleep with maybe a blanket, And when you woke up, the blanket wasn't there. And you're searching and searching for that blanket, and you're fumbling, and then it gets to the point of frustration, and then you fully wake yourself up. That's kind of what's going on. Except, of course, there's no blankets involved because you were practicing safe sleep habits, but I think that that's a pretty good analogy when it comes to trying to explain these awakening cycles. Essentially, your baby's waking up a little bit more fully, having a difficult time putting themselves back to sleep. How do you get through this? Great question, and so many answers, so many tips. If you're interested in learning, make sure you tune in, hit subscribe below, and we'll cover this in the next video. Have a good week. Bye.